Hi all, this is Maylene Velasquez. I am a licensed clinical social worker and a registered play therapist. Today I was hoping that we can have a little discussion about some things to keep in mind when we're working with children that have experienced traumas and are having traumatic memories and experiences that are coming up for them that you're going to be working in the counseling room. In specific, I'm hoping that this video will provide you some ideas as to how to explain treatment to parents, how to integrate them into the work that you're going to be doing, and also how to explain the purpose of the work that you're going to be doing with the clients that you're working with. Many of the children that we work with, whether we're thinking about private practice or whether we're working with children within the community, whether in offices that they're going to, whether right now through telehealth or through home visits, are referred to us typically because there's behavioral problems that are happening that are getting in the way of the everyday functioning of the child and of the family system. One of the first things that's really important for me to do in counseling is to move the focus from the behavior that everybody's seeing, right? The problem behavior, the meltdowns, maybe the anger outbursts, maybe trouble with school, whatever might be showing up for your client. So to move it from the behavior to a place of understanding what is beneath that behavior, what are the emotions that that child's manifesting, and what is it that they need in order to have a little bit more of emotional stability. As someone trained in infant mental health, one of the things that I always keep in mind is how do we integrate parents and caregivers into the work that we're doing with children so that they serve as a protective factor for our clients, and so that there is a sense of continuity from the work that you're doing into the office, into what's happening on the everyday life of that child. Whenever I receive a new client, the very first thing that I do is really focus on scheduling a session with the parent or the caregiver, whoever that might be. It might be a grandparent, might be another family member, might be another loved one. So whoever is important in that client's life, whoever is taking care of them, that's the person that I want in the office. If you're working with clients in the child welfare system, then use your clinical judgment and applicable laws to decide who is important to be present in that session with a child. Taking this very first important step is really the foundation to most of the work that I do with my clients. During that very first session, I'm going to be collecting information as to the experience that the caregiver is having, what happened, what is their understanding of what happened, and also what is their understanding of how what happened is affecting the child. I'm going to really focus my energy on building a strong relationship with that caregiver through validating, through listening, and through being interested in their understanding of the experience that took place. Once I'm feeling that there is good rapport, that there's a positive relationship, and I've collected a lot of information about what took place, I'm also going to create a bridge between the experience and what the parent might be going through. And this is especially important because awareness of the internal processes for the parent, right? So if the parent is aware of their own experience, that's really going to help them to become aware of what the child might be experiencing. Keeping in mind that what we don't recognize within ourselves is going to be really difficult to recognize within others. So in a sense, it's a parallel relationship. As you build rapport with the parent, as you validate the parent, then you're in a way modeling for that parent to really be present and validate what the child is experiencing. As we check in with the parent, we're going to be assessing for any mental health concerns that the parent might be expressing, perhaps not in those words, but that really require careful attention for that caregiver to then provide a safe and protected space for that child. As we're assessing, we're going to start providing some psychoeducation as to how does trauma affect the brain, how trauma is in the eye of the beholder, how traumatic experiences for many children can turn into really serious and severe behavioral issues, and how if we only focus on that behavior, we're not going to reach the root of the concern or the root of the issue that a child is experiencing, which in turn will affect the family dynamics. We're also going to begin providing information as to not only how trauma affects the child, but how trauma affects the caregiver, and how it affects family dynamics. Make sure to use your training, your clinical experience, and your supervision to really help guide this process and to conceptualize it either in consultation or with the information that you have from your training to ensure that it meets the needs of the families that you're working with. As you're providing pieces of psychoeducation regarding trauma, you want to make sure that you're checking in with a caregiver to assess their level of responsiveness and also to assess their level of activation. Are they currently ready and able to be a protective factor and to be a holding container for what the child is going to be experiencing? Are they understanding and connecting with your explanation? I know that sometimes I phrase certain questions or sentences in a way that make really good sense in my mind, but when I say them out loud to the parent, I can see that there's a question mark. Usually I'll acknowledge, I know that sometimes I say things that don't make sense, so please feel free to let me know if there's anything that I'm saying that's not making sense. I like to provide that leeway in because it really then allows me the opportunity to check in a way that's not very intrusive and that feels natural and authentic. Once I've built a relationship, I've conducted an assessment to determine whether there's any need for the parent, for example, to be referred into individual counseling. And after I've provided the psychoeducation and checked in with the parent's experience, the next step is that I'm going to explain the counseling that we're going to be doing. The explanation will depend on the intervention that you're going to be utilizing. Whatever it is that you have been trained on, it is just very crucial that we're taking the time to really explain the process to the parents so that they understand what it is that we're doing, what the purpose of it is, and again, so that they can support the work that's being done together. I find that this is a piece that we can easily lose, and I know for me early in my career, this was a piece that I would lose all the time. In part because it's hard to keep everything that's happening in mind. But in treatment, we always consider the parent, the child, and the relationship. Understanding this three-part process and keeping it in mind can really help us to be able to connect with what the family actually needs. Of course, up to this time, I still haven't met with a child one-on-one. So now I'm going to work with the parent on really creating a story where we're going to help the child understand the purpose of why they are in counseling. I find that this is also another step that is very easily lost. And you probably guessed this, but I'm going to discuss with the parent first, before meeting with the child, how I'm going to be explaining the purpose of treatment. If the parent is available and able to, I'm going to have them be present. And sometimes it might be useful to really have the parent be the one that explains the purpose of counseling to the child, guided by you as the clinician who's going to be present. And for this piece, what I use is a trauma triangle. The triangle is something that I borrowed from my training in infant mental health. It's very specific to a practice called child-parent psychotherapy. And the triangle involves a 4-part process. I have it here to show you all. And so here is my drawing of a trauma triangle. When working with parents, I might create a drawing like this with the specifics as to what the child experienced and what's happening in the diet. And I'm going to ask the parent their level of comfort with sharing the reason for treatment with the child. So a basic trauma triangle is going to explain to the child what happened, what they're experiencing as a result, the purpose of treatment, and it's also going to include a hopeful and protective message that the parent is going to be providing to the child. So an example of this would be having the child and the parent in the office, and the parent says to the child, "Johnny, you're here because you saw Daddy get into a really big fight with Mommy, and you saw that Daddy hit Mommy. Since that happened, you have been having a lot of trouble sleeping. You have been very scared that the police might come over every time you hear the door knocking or every time you hear the sound of the police sirens. You're also having a lot of trouble in school. You're not really concentrating, and you've been feeling really, really mad. We're here because this is a place where we can really talk about what happened, and we can really help you to be able to share your feelings about everything that you're experiencing. I'm gonna make sure that this doesn't happen to you again. I'm going to make sure that I take really good care of you because I really love you and I'm here to protect you and to make sure that we have a really good and happy life together. And so as you can hear, the trauma narrative can be really, really activating or triggering for a parent to conduct, which is one of the reasons that we want to assess where that caregiver is and what their capacity to be present is. Like I mentioned earlier, ideally you have the caregiver share the different pieces of it. This is going to be a little bit easier since the parent would have practiced it with you before saying it to the child. If at any point the parent gets stuck in any of the pieces, you can let them know ahead of time that you might jump in and just provide some support here and there. That way you're letting them know it's okay if you get stuck and we're here to figure this out together. And so this is a really crucial way to demystify the work that you're doing together. And for your child client to begin understanding that we get it. We acknowledge that something did happen and that we're not only here because you're behaving badly or you're getting in trouble. That we understand that when scary things happen, that there's going to be a resultant behavior, but that we're going to figure it out together. And then you conduct your treatment in the way that you have been trained to. So here was some feedback about how I introduce a treatment to the clients that I'm working with. This can be very useful when you're working with a trauma counseling case, or also when you're working with other issues that might be coming up, to really create a story and to help build the understanding of what are we doing here and what is the purpose of this. Thank you so much for tuning in. I hope that this was useful and helpful to your practice. If there's anything else that you would like to hear, please let me know. Thank you. Bye.